and more people are likely to die from family recipes than their DNA. Obesity-related diseases are top killers, but let's face it, old eating habits die hard. Our next guest has so many success stories that he finally had to spell it out on how to do it in his book, Eat This, Lose That. Welcome back, Dr. Reddy from Reddy Cardiac Wellness.
Thank you.
I've asked you this before, and people oftentimes when I say, well, if you're dealing with type 2 diabetes, Dr. Reddy, they go, well, what is he? I say, a cardiologist. And they go, why is a cardiologist dealing with type 2 diabetes?
And the answer is simple. Diabetes is the mother of all illnesses. And if you contain and control diabetes and reverse diabetes, you basically decrease the chance of having heart disease, dementia, high blood pressure, kidney damage, stomach problems, arthritis, all the problems you can think of. Diabetes is the mother. And every time you have diabetes and every time you eat, you're slowly cooking yourself. In 15 years, you're going to have all the diabetic complications. And all you have to do is change the way you eat.
Yeah, and this is interesting because, you know, we talked earlier about people who may have a gene for breast cancer. They can't help that. But
Correct.
Type 2 diabetes, we really can control. I think for a long time we kept thinking that we couldn't. It was part of our DNA, or we can just take some insulin or some medication or whatever and it'll take care of the problem for us.
Type 2 diabetes is self-inflicted. We do it to ourselves and due to ignorance. And all it is simply understanding the concepts and change the diet and you can reverse it.
All right. Well, one of Dr. Reddy's patients was overweight and taking 9 pills a day for a heart condition. Even with medication, she wasn't getting any better.
If I had to take all those medications and feel and live the way I was living, I did not want to live anymore, and that's the truth. I've been taking off 7 medications in a month, and I feel fabulous.
Wow. Well, Marilyn started the Reddy Wellness Program and has since lost 50 pounds. Look at that picture before. And would you like to see what she looks like now, 50 pounds lighter? Yeah. All right, Marilyn, come on out here. Look at her. Wow.
Thank you.
What a difference. Now, we just heard you say, if I have to continue like this, I don't want to live anymore.
Exactly.
That's a strong statement.
Yes, it's the truth.
And now, you got a smile on your face.
My friend told me I have my giggle back.
Aww.
Isn't that wonderful?
Yeah. Okay, so we were talking earlier about you were taking 9 different pills. We are under the delusion, probably, or illusion that if we take the medicine, everything's okay.
That's right. So the question you have to ask is, are you treating the cause or are you treating the symptom? Medications only help in treating the symptoms, not the cause. And in her case, she was tired. She had symptoms of sleep apnea. She was overweight. She had heart disease. She had high blood pressure. She works for almost 8 hours straight standing. And she was having body aches and she was getting more and more tired. Now what happened? She comes to the office and she says, I changed cardiologists because my previous cardiologist said, if I want to go on a good diet, go to Whole Foods. So she said, that's not the right answer. So that's when she came to our office. And then
right, because there's still just things that we have to know exactly what we need to pick
Correct.
in those foods. And I get what he was trying to gear you toward eating a healthier way. But in this case, what you have done, Dr. Reddy, is because we need to be told exactly what do I need to eat. How hard was it for you to switch those eating habits?
Well, let me say, it wasn't really all that difficult because I was ready. Okay, yeah. I was ready to make a change, and but however, this is a simple program, but it's not real easy. It's not as easy as you might think. However, when you're desperate and you want to make a change and you want to change your life and you want to become healthy again, you're willing to do all kinds of things. And once I started it, it wasn't as difficult as I thought it was going to be.
And the thing is that people will ask me, well, what kind of food are they talking about?
Yeah.
It's all real food.
Exactly.
It's all
so
real food.
Let's be clear. When she said the program, basically we have a program that teaches the participant what to eat and what not to eat, and the whole idea is to go to a grocery store and buy the right kind of food. That's exactly what she's done. And out of 9 medications, she dropped 8 medications to date, and she's taking the last medication 3 times a week.
And I literally said in the intro that you've basically pumped new life into your heart.
Absolutely.
And so what we do show, Dr. Reddy, is when you get rid of that type 2 diabetes, that you actually add years back to your life. Your body gives you a little bit of time to act up, but then you got to fix it.
That is correct. In fact, there is a recent article in Nature scientific journal which talked about inflammation. If you have inflammation, you're accelerating aging. Not only that, you're also putting yourself at risk for diabetes, heart disease, and all the problems, including dementia. If you decrease inflammation, you reverse these. But how do you decrease inflammation? By changing the diet, not by taking medications. That's exactly what she did.
And you feel like 150% better?
Absolutely.
In just 90 days. You saw Dr. Reddy on this show, actually.
That's exactly what happened. I was searching for a doctor who could give me the answer. And I saw your show. And that's how I got to know Dr. Reddy. And thank you, Deborah, for that, too.
Well, thank you for making that phone call.
Thank you.
Thank you. Yeah, for bringing the message. Absolutely. All right. And as you said, it wasn't that difficult once you knew what you're supposed to do. And this is one of those things that you want people to take charge of their own life. You don't have to suffer when it comes to type 2 diabetes. You don't have to suffer. You can turn things around, and we need to in this country.
That's correct. And so the whole idea is by just changing diet, what happened? Her blood pressure became normal. Her blood sugar dropped. Her what we call weight dropped. Her symptoms of arthritis disappeared. Her symptoms of sleep apnea disappeared. Her attitude changed. She wakes up happy, and even her friend said, your previous old giggle has come back.
Yeah.
Now, what price can you pay for that?
It's priceless. It's priceless.
Priceless.
And of course, without those medications, didn't have to deal with side effects of that.
That's
the
right.
whole bit. For more information or to get a copy of Dr. Reddy's book, you can call Reddy Cardiac Wellness at 281-491-0044, 281-491-0044, or visit reddycardiology.com or reddybread.com, because he actually has this bread that if you are somebody who's, we're addicted to our carbs, that this bread can kind of get rid of that addiction, make you feel like you got some bread, but it doesn't do what regular bread does in your body. So all kinds of things to help you get through that diet.
One more point I want to add. Now she does not want to retire. She wants to continue to work and keep milking the system.
All right. Well, hey, don't forget to log on to Facebook to let us know, have you discouraged your child from playing sports because you're concerned they'll get injured? We'll share some of your comments a little bit later on in the show. Well, if your kids do play sports, up next, the things you can do to help prevent traumatic brain injuries in particular.